It's very informative report. There are several measures. I think the mentioned by President Xi. The first is how to build a public health policy that prioritize prevention. I think that's super important. So, for example, in some part of China now, the family doctor system have been built or is building. So this is helpful for the patients to have a tier of care system. They first contact their family doctors in order to get pre-screening, and they can then being referred to higher level hospitals. This will be a very effective measure to reduce the overcapacity, overcrowd out of the healthcare system. So also, I think the payment system, payment incentive could be also reformed at the local level to incentivize the doctors, primary care workers to have more incentive to treat patients, avoid them to be worsen into a larger disease. And also, President Xi was mentioning about the stronger legal support in the public health and the scale up of the lawmaking. The legislation is really important, giving this point, because President Xi was mentioning this legislation to strengthen the legal support in public health should be across the board. That means the parties and the health authorities involved in the public health are all involved in. For example, China's Ministry of Health, the National Health Commission, China CDC, and which is under the China Health Commission, and also the China's Medical Security Administration. So they are play different role, but they are all involved. For example, this time, in order to treat more patients, the payers, the insurance side, the Medical Security Administration will make it more generous to treat more patients and without charging them in front of before the treatment. So this is a policy to encourage people to come out and get immediate treatment and diagnose in order to try to mitigate the cross-infection risk.